Good morning, everybody. I wanted to be able to talk to you today about something that I want you all to be aware of if you're a caregiver, that if this ever happens to you, you'll know what might be going on and how to handle it. So last Friday, my sister and I had gotten our mother up to use the restroom before my sister went to work. So Mom would she wouldn't go, so we just decided we would take her and put her back in the bed. So when we got her to the bed, uh, for a few minutes, she died on us. She went limp. Her eyes were fixed. She quit breathing, and so Sandra and I died 1,000 deaths that morning. But we have an awesome uh, hospice doctor, and within 10 or 15 minutes he was there. But in the meantime, he told us what to do, to put Mom on the bed and make sure her feet and legs were up above her head, higher than her head. And we, kind of shook her and was trying to get her to come to. And within just a couple of minutes, she started breathing again and came to. We later found out that this is called neurogenic syncope, or sometimes they call it vaguling. And it's where you can try to be using the restroom either way. You can do it from throwing up or different things like that, but it causes a lack of blood flow to the brain. It could be some kind of emotional distress of trying to strain to use the restroom and you can't, and it can cause that. It's vaguling. So just wanted to make sure everybody knew that if you're caring for your whoever, if it's your loved one or whoever you're caring for, this is something you could look out for, because I don't ever want to have anybody go through what we went through. Mom's at a different stage now than the videos you'll see that I post, but just wanted everybody to know that there is something called vaguling, neurogenic syncope, where they can have emotional distress or be trying to use the restroom in either way, and it can cause them to pass out. And so we thought Mom was dead, and I never want anybody to go through that, because like I said, we died 1,000 deaths that day. But just remember, if you're dealing with a patient and they do that on you, get them on a bed and make sure you take pillows or something and elevate their legs and feet so it's raised higher than their head is. So just wanted to tell everybody that today. It was a very scary thing. I'm not going to ever try to tell you anything that we haven't already experienced, but I want you to be prepared and tell you things that you can write down and have like a reference sheet of things that could happen that you may not know about that could happen. So I hope everybody's having a good day. Remember, I need to take this advice myself, to always take care of yourself, or you can't take care of anybody else. Everybody have a good weekend and a happy Father's Day.